everyone. Welcome. We're just going to dance. Wait till we are live on Facebook. Make sure we are ready to go. How are you? I hope you guys are having a great Thursday. And we are just going to pull it up here because I want to see if you guys have any questions at any moment. So we are going to, there we go. We are live. Hello, everyone. So today, make sure, there we go. Facebook, make sure we are ready to go. Hold on. There we go. All right. So if you guys have any questions, please drop them in the chat. I have the chat box open over here. But we are live today with the one and only Alyssa. And hello. Thank you so much for joining us.
Thanks for having me.
Yes,
I'm excited.
So this was totally last minute. I mean, her and I have been talking just within the past day. And I said, oh, you would be awesome to have on the show because this week was basically an impromptu dental health week. We had Ella lose her tooth. Her front tooth, which her other front tooth is just like dangling there. Like I'm ready for that other front tooth to come out. But it was good. She loved it. The tooth fairy came. And then the next day we went to the dentist. We went to a new dentist after having a lot of, I don't want to say difficulties to an extent, but we've had our challenges going to the dentist. You know, ever since Ella was 3, we've had some issues. We had to find the right dentist, found one in Pittsburgh, and then had to transfer to Georgia, had to go through a couple dentists here, and we found a good one yesterday the other day that we went to. So it was just kind of a great way to continue talking about dental health, preparing our kids for going to the dentist, what to expect, and then even us as parents, preparing us for what questions do we need to ask? Because if we don't ask the questions, we're not going to know. If you don't get the information and educated on things, no one's going to just come out and tell you some of these things, right? So today I have Alyssa. She's a dental hygienist. How long have you said?
13 years.
13 years. So we're definitely going to get some more expert advice here. And go ahead, Alyssa, you can fill in there.
All right. Well, hi, it's nice to talk to everybody here. I'm just going to kind of go through and go with what parents, like the parents' role in making the visit good, the dental hygiene at home, and to prepare yourself too, and some questions that you can ask. Because I was kind of like reading through the comments and I just got some ideas. And as far as some cavity-causing foods, the mom guilt that goes when kids have cavities, and we're just going to kind of cover a little bit of basics on that. First, I'd like to say that these are just my thoughts and views from my experience. Like I said, for 13 years, they in no way are affiliated with my own office or any of the offices that I worked with. This is just my personal experience as a mom with a dental hygiene background. Okay.
Perfect. I love it. And I'm so appreciative of you joining us today and sharing this information with the parents. So thank you so much for this.
No problem. Okay, so let's start with preparing for the very first visit. And this I would do until you know that your kids are just like, okay, I'm going to hop in the chair and do it. So I would do this every single time because 6 months, if you're going every 6 months, they forget. They can forget. As a hygienist, I do the same thing for the very first few visits too. So one of the first things that you can start preparing for your first visit weeks before the appointment date. One is, how do you feel about the dentist? Have they heard you say, oh, I gotta go to the dentist? Like one of the things that a lot of people say when they sit in my chair is like, no offense, but this isn't my favorite place to be, like, all right, let's go. And I can talk more on that. Like that's more, those phobias can start when we're a child. So that's why it's so important to have a great first experience. And you can start by talking positively about it, being excited about it, There are so many books that you can read. I'm a Bernstein Bears. That's what I grew up on. So I've also been reading that to my children. Daniel Tiger, I know, has one. You can find whatever your child's into and probably find a book or a show that has to do with the dentist. Most of them, do that. And you want to read that and you want to talk about what's going on. Why are teeth important? What do teeth do? One fun thing to do with them is like, teeth help you talk, and then you have them pretend like they don't have teeth. Or like, it's a fun activity. Like you talk, so this is why it's so important that we take care of our teeth. Baby teeth hold the place for the permanent teeth so that we do have teeth when we're older and not, I don't give like a grandma or anything that has false teeth. You know what I mean? Like you just kind of play around with that. We talk about, they help us chew our food, our yummy food. They help us talk with a pretty smile, to show how we're feeling. So lots of things that you can do just talking about why teeth are important, and preparing for that visit. One thing as a parent you can do, now I was reading some of the comments and some say, well, some don't want the parent to come back with the child. There are reasons for that. The parent, sometimes, like I said, the kids can pick up on their energy. Sometimes the child is better cooperated if the parent's not there. That's not always the case, but that's, sometimes. And certain offices have certain rules. If that's not okay with you and you get to an office and they say that, this may not be the right office for you. There's nothing wrong with it. That's just their rules and that may not be the right office for you. So when you're calling to make your first appointment, you want to ask that question. Is it okay that I'm allowed to be back there? Now, I will say eventually you want to get to the point where you don't go back. You want to give them that independence, but that might not be the first 3, 4, 5, 6, 7, 10 visits. You know what I mean? Eventually you do want to get them to go back. But then when the doctor comes in for the exam, you want to be there so you don't have to, so you hear firsthand.
Right.
Great.
Those are great tips, and to definitely ask for sure whenever you have that first, initial phone call, because that's something that people forget to ask or don't realize. I would never have realized that was, a thing.
Right. And then you're already there and you're like, are you going to wait? Because sometimes, I don't know, around here, like children's, like you have to book in a lot of time in advance. And that's another question too. Do you go to a pediatric dentist or do you just go to a family dentist?
That's huge. I'm so glad that you brought that up, because that was a big thing for us, where I am looking for a family dentist. And it caused a lot of delay for Ella as she was having cavities when she was 3. And it turned out I actually needed a pediatric dentist. So even going to these family dentists, it wasn't the right choice. And then by the time we got to a pediatric dentist, now it's too late and she has to have some major dental work done. That's a good point. I'm excited to hear your views on, what's the difference.
So I think it's a personal preference. So your child, a pediatric dentist is going to have, it's tailored to children. You're going to walk in, there's probably going to be TV shows with cartoons, all kinds of toys. Who knows now post-COVID, but you know what I mean? Children's books, like you're not going to have that at a family dentist. You might have a little bit, but it's not going to be geared towards kids.
Colors,
so your child,
a lot of colors and different,
animals, characters. So it's going to be a more, I would say, like, walking in, like a more welcoming experience. But they're the child dentist. They're going to want to get things done. A family dentist is going to, like, the most important thing I said is to create that great experience. And that's going to kind of tie into my next topic, like the first visit. But so you just kind of have to, like, if you have a family dentist and you like love them and you love the person that cleans your teeth, you might want to have them start there if there's no problems. If there's problems, if they're saying that their tooth hurts or something, personally, I would take my child to a pediatric. If there's not problems, like my kids go to where I work, they go to a family dentist now. I started them out at a pediatric office. So I think it's just like a preference. Your child, but again, I don't push anything with the first visit. So I'm going to kind of segue into like the first visit now, and I'll kind of go back and forth with that. A lot of things are reward too. I know you talked about rewards. So for that first visit, a lot of times we're like, oh, okay, well, if you're good, we'll go get ice cream after, we'll go pick out a toy. How about reward them if they try?
Mm-hmm.
Because it's a big deal to kids.
Yeah. Yeah.
It's a very big deal. You're going into a new place, someone's like above you, they have a mask on, they have goggles on, you know, it's a big deal. So, and trying might be different. Like if your kid's extremely shy, trying might be just sitting in the chair, and that might be all that happens that day.
I love
you
that.
know, so you just have to have zero expectations of that first visit.
Yep.
Yeah. You can bring sunglasses. A lot of places will have them, but like the light, I know a lot of kids have problems with like the light, so you can bring their own sunglasses to make them feel more comfortable. But again, the biggest thing is to have zero expectations. They may get their teeth cleaned, they may go the whole 9 yards, or they may just sit in the chair and look at some of the equipment, and that's okay. You'd be surprised what 6 months can do in development. You know, I mean, the next time they might come and pop in your chair, and vice versa. They might have popped in your chair and did everything, and in 6 months, they don't want anything to do with you. So, I mean, you just kind of have to go with the flow. One thing that I do is I like to show them everything. First of all, you have to get down on their level. You do not want to be talking to them from standing up. So you get down on their level, and you use a little bit of a softer voice, and you show them all the equipment that you're going to be using. You let them touch it and play with it. So there's Mr. Thirsty, which is the suction thing, Mr. Scrubbers, which is the polisher. You let them pick out their flavor of polish, of toothpaste. Mm-hmm. That's what I call it, but it's polish. And then they have like the water squirter. So I'll let them like squirt the wall. If I know the mom, if she's my patient, like I'll let them squirt her. You know what I mean? Like let them kind of have fun, put water in a cup, let them see how it sucks up in the cup, and then let them try it in their mouth. Yeah. So they just kind of get a hands-on feel. So if you're at a place and they're not doing it, you might just intervene and just be like, hey, do you mind showing him what you're going to use before you use it? I think that would be a better experience.
Absolutely. And that absolutely goes with, you're telling your kids about the experience as you're going, or as you said, weeks before, which I think is amazing because you're prepping them for that experience, and then once you get there and they're just ready to go right in, but your kid is expecting like, oh, I want to see this tool, or I want to see what you're putting in now,
Yeah.
So definitely speak up. I think that is another part of where we're kind of going with this, is that even though we have professionals, we as the parents also need to use our voice to advocate for our kids and, just get better educated on everything, which is why you are here. I'm glad.
Now, I will say 9 times out of 10, they're going to do this. Like, you're taught in school how to get on a child's level and show them the different things, but things get busy. Sometimes you forget. You may not realize that they're not really familiar with the office. Because like I said, you do this the first time, but you do it the second, and you do it a few times until you know that child is comfortable and that you can just, just like an adult, you would just kind of dig in. So to speak.
Right.
So, but yeah, because like I said, 6 months is a long time, and they might forget all the equipment and everything. Or you can be like, oh, do you remember this? So again, it's just very important to create that positive experience. If they're not having it, you're going to want to try. You're going to want to try to push a little, but you're going to know when, and the parent being there too, your child, when it's kind of like, what, let's just do something maybe fun, give them a sticker. Let's try again in 6 months.
Yeah.
You know what I mean? And you just have to be vocal. Like you said, if you don't want to make that, you don't want a stressful visit for the first child, because you are setting that up.
Yeah.
I will go back to when people say, when they hop in the chair, I'm like, no offense, I don't thank you. 9 times out of 10 is because they had a bad childhood experience.
Yeah.
And that kind of goes with just the advancements in dentistry. We used to use something when you had to get a tooth filling called Novocaine. Well, it doesn't last as long because it metabolizes in the blood, not the liver. So you're numb, but your tooth's not numb. And I think the dentist is thinking, you have to be numb. I just gave you all this, but you weren't numb. And that created a bad experience, and you carry that with you a long time. So that's just one possible thing that could have, but is common that has happened with people like my age.
Right. Even Ella, the first time we went to the pediatric dentist, they had to put her under. And instead of giving a drink, or instead of, she got a shot to get her,
Okay.
that's the only thing she remembers. I got a shot at the dentist,
Okay.
and that kind of like
It sets the tone.
A lot of time, for a couple years.
Yeah.
And we had to go more than one time now to kind of say, you're not going to get a shot at the dentist. Like, that's not normal,
Right.
And, and it's funny because now she wants to be a dentist. So
that's awesome.
it's kind of like, okay, well, maybe that experience, she's like, I don't want anyone to do that. And that's, she's sick. So I don't know if that's the reason, but I thought that was kind of interesting, to kind of make experiences better going forward. I don't know.
I hated the dentist growing up. In fact, when I told my mom that I was going back to school for this, she's like, you're kidding me, right? She's like, you were like 14 and giving me trouble. Like, are you serious right now? I'm like, yeah, I want to prevent that, for others. Yeah, so you definitely have a point there.
Yeah.
Okay. Are there any questions yet?
I don't think so. Let me check on here. All right. So what else? We want to talk also about, let's check it here. Check some, the cavities, the food, or what else? What else did you have on your list?
Well, so we can talk about home care, brushing the kids' teeth and everything like that at home, and what the parents' role in that. So ideally, you should be helping your child brush their teeth until they are very capable, when you see that they're capable on their own. So about 6 to 8 years, which, is hard. We have a million other things going on. So as they get older, you might want to make a game out of it, like have them brush their teeth, and then you check so that you're not really rebrushing, you're just making sure. And that's another good way to tell if they are doing a good job. There's power brushes for age 3 and over. Under 3, they should definitely use a manual one. And it should be a soft bristle, and it should be the right size. You do not want to put too big of a toothbrush in a kid's mouth. It's going to miss spaces, plus they're not going to like it. It's going to be filled, big and bulky.
Right.
Power brushes are good. Again, that's something they'll have to get used to, so just, take it easily with patience. You say, you always say everything's about patience and not creating that, that stress environment.
Absolutely.
Let me see. Floss. Do you use the floss picks with the kids, or do they floss? Yeah, they can do the floss picks themselves. You can do it. If you're doing it, you can use the manual floss too. It's just, a preference of yours. But the floss picks get in there and they get out in between the teeth pretty well. As an adult, I definitely recommend regular floss, but for kids, that works pretty well. Okay, a rinse, if they can swish and swallow, or swish and not swallow, spit it out. So you would try with water first.
Okay.
Teach them how to swish, spit it out. Once you're sure that they're not swallowing it, then you can incorporate a mouth rinse.
That's perfect. Do you have any recommendations on that? Because I bought the kids a kid's version. Like, oh, great, I'm going to get you your version. I ended up having to use it one day, and I was like, it's so sugary. Like, what's the point? Like, you're putting more sugar on your teeth.
Yeah. I don't know. Which one was that? Do you know?
Oh, I don't know. I want to say it was an Act one, but it was like a bubblegum flavor. Or, so it wasn't a minty one.
Yeah. Well, most kids won't handle mint well. My favorite product for kids that will handle it and adults is called Stella Life. It's an all natural product. And it has a very mild mint. So my kids actually use that. We have used Smart Rinse from Listerine too, because they have like a pink lemonade flavor. I'd have to look at the ingredients. The sugar is probably xylitol, which is okay.
It's okay.
The xylitol, yeah, it's actually anti-cavity.
Okay, good.
Yeah, so
I mean, I
they put gum
figured it
and
was,
stuff.
but when you put it in your mouth and it's very sweet tasting,
Yeah,
I was like, well, wait a second.
that's going to be more for patient compliance. That's going to be more so that they use it. You know what I mean? Like I said,
Right.
they're not going to use something that's really minty and doesn't taste like it. You want them to have it taste well.
Right.
So that they use it, not that they're drinking it, but you know what I mean? They're switching your mouth. You want to make sure they're not drinking it. And a lot of the questions I get too about fluoride-free versus fluoride toothpaste, I'm not going to get in. Fluoride is controversial, and I feel like as a parent, you need to research that and do what you feel comfortable with. But I will say you do not want to use a fluoride toothpaste until they can brush and spit and not swallow. And they say at age 3 on the, I think on the instructions or on the warning, but it's basically if your child can brush, spit, and not swallow. So that might be 2, that might be 5 for some kids. So that's basically the guideline for that. Just a little side tip. One of the spots that they miss the most when they brush is under the tongue. The bottom, right around the gum line between the tongue and the teeth, because the brush just like they don't like that feel. So that's an area to keep watch on. As parents.
All right.
Yeah.
Now I know. Noted.
Just a little tip. That's where I find a lot of the plaque build up, in kids. It's one of those areas.
That's good. I know for my kids, it's definitely in between their teeth. So it's definitely like we know.
The flossing.
Yeah, we know we need to floss even better.
Do they use a power brush?
They do.
Okay, that's good. Yeah, because that does help a little bit better.
Yeah.
Oh, and 2 minutes. Do you have a 2-minute timer?
That was what I was going to say, actually. So I've used one on my phone, and actually we've used one that was
like a sand timer.
Yes, like a sand timer.
That works.
Alex likes that now,
Okay.
But we've used our timer on our phone, and even the toothbrush has like a 2-minute timer on it.
Yes, that's good. Yeah, because even as adults, like 2 minutes is longer than you think. Like my son will be in there and he's like, oh, I brushed. I'm like, you were in there for 30 seconds. Get back in there. He's 11. I'm like, get back in there and set a timer, because it's just in their head. I brushed for 2 minutes. And I'm, no, you didn't. So, even myself, I find myself, I have a power brush for morning and night, but if I'm just brushing really quickly, like after lunch or something like that, I'm like, oh yeah, I was not in there long enough. So
I catch my son doing that all the time. I'm like, that was not long enough. Get back in there. Like,
do they have you if you ask them if they brush their teeth and they say yes, and you're like, well, if I go in there, I'm gonna see a wet toothbrush, well, maybe. I'm like, get back in there. Like, don't pull that.
Let me smell your breath. And they're like, oh, okay, never mind.
Yes. So that's, I think every mom has that story. So so if you're out there and you hear that and you're thinking, no, let me just set the record. My kid has had cavities, so I had the mom guilt and the professional guilt. So I mean, it was an interesting visit. They're like, it's just cavities, it's gonna be okay. But I felt like, the mom guilt, like, what do you mean? Like, I've done everything that I could possibly do.
Yes. And
that's what I'm gonna get into next is some cavity causing foods that are healthy, but they're cavity causing too, So, well, first of all, as far as candy, gummies, sticky, anything that's sticky candy, like hard pack candy, anything like that has like a sticky consistency. Those are the worst as far as cavity building. So a better treat would be like chocolate or ice cream, in moderation, obviously. But the gummies are, I think, one of the major reasons why we're seeing an uprise in children's tooth decay. Because they're convenient.
Yeah.
The kids like them. You can get even like the organic ones that have like the natural fruit in them.
They're still gummy.
It's still sugar.
And even vitamins. This is another thing. Because a lot of the vitamins are now gummy vitamins.
Yep.
And it's very hard to find a vitamin that is that they like.
That they'll eat too.
Yeah. And I was like I look at the shelf and I'm like, 90% of these are gummy,
Yep. So I feel like that's a big reason. And just in general, just the foods that we have now in the United States is, they're just very acidic foods, and they're just more cavity causing foods, like not too many. And it's the convenience factor. Like if you eat very, very organic, very healthy, I'm not saying that you can't get cavities, but your chances are less likely than if you use like the sugar, the starches, the processed, foods that break down the sugar, juices. So this, I think, was my big problem with my children, because I flossed myself. So I know I'm doing it right. You know what I mean? I brushed their teeth. This is my son, not my daughter. My daughter was good, but he was not a milk drinker. Water, not so much. And he was not a vegetable eater. So I did the V8 juice. Like I'd have to do a glass or two that a day, because that's how I got his fruit and vegetable servings in him, from a nutrition point. But juice is really, not that great for your teeth.
Wow.
But you have to do everything in moderation. You can't stress yourself out with this, because there are worse things than cavities. You do what you can. Sometimes you do everything you can. There's genetic factors. It's about the bacteria that's in your mouth.
Yes.
Like some people have it more than others. My husband can go without brushing his teeth and not go to the dentist for 2 years, and then his teeth are perfect. I missed one day of flossing, I have a cavity. My kids got my teeth, you know what I mean? So there's definitely some genetic factors in there. Baby teeth are not as dense as adult teeth. So when a cavity starts in a baby tooth, it's very important to catch it early. And that's why you go to the dentist. That's why you get your teeth checked, because it can blow up pretty quickly, because there's not as much enamel. The pulp of the tooth is much larger than the pulp of an adult tooth.
Yeah.
So it goes slower in adults, faster in children.
And that is what happened actually to Ella. But from the time I saw it to the time we found a pediatric dentist, someone that could treat her, it was too late. We had to have a tooth extracted, and she had to have a cap on another one. And, it was just I couldn't even believe how quickly that cavity in those two teeth, I couldn't believe how fast they happen, and they grew.
Yeah.
So
and then that happened to my friend. She's so they had an appointment right before, and then COVID came and the shutdown happened and everything. And then by the time that they got back, she's like, oh my God, my kid has all these cavities. And I'm like, well, they probably weren't that big. You would have caught them. You would have been able to maybe do something without having to put them under. But it just happens, and we have to give ourselves grace.
Yes.
We have to give ourselves, as moms, as dads, as parents, caregivers, guardians, we have to give ourselves grace. The fact that you're taking them to the dentist shows that you care,
Right.
So you have to remember that things happen. It's not the end of the world if they get a cavity. It's hard as to put your child under for dental care. It absolutely is hard, but that's why they have it, so that they can get everything done at once.
Right.
Yeah.
And that was the other question I had for you is, what age would you say? Because when I went this was not even that long ago. So this was 6 years ago. Okay. Ella was born 6 years ago. And no one told me, here I am. She's got teeth. I'm ready to take her to the dentist. And luckily my family dentist was very hands-on. So she was like, just have her come sit in your lap. Let me just, take a peek. And it was really easing it into it. But no one specifically said, you should take them to the doctor at 1 year. Because what they were telling me was 3 years. That's about a good time, 3 years. And I was like, but at that point, that's already 2 years in that they have a full mouth of teeth.
Yes. Yeah. So I guess it would depend on the American Academy of Pediatrics, recommends, or the pediatric dentist, they recommend as soon as they get their first tooth. To me, that's a little much. Again, if you're going to the dentist, I think that's a good idea that they can just pop in. You're not going to probably clean a baby's teeth it too, but they can look and they can check and, stuff like that. At that point, you're probably looking at a pediatric dentist. Most family practices do recommend getting their first cleaning at like 3.
Okay.
Yeah.
So
Or
then it wasn't totally off, but it was like after I started going to the pediatric dentist, they were like, well, you should have been here at 1. And I was like, well, no one told me that.
yeah,
Like those
yeah.
things as moms, like, how do we know unless someone's telling us,
Right. And I think that just depends, like if you're seeing something, obviously you're going to go a little sooner. If your child's very cooperative and stuff, you might try it too. Like I tell my patients, your child, as far as the cleaning, like they can have it definitely looked at. But
Right.
I just think it's unrealistic to think that you're going to be able to get out Mr. Scrubbers and, on a 2-year-old. I just think it's a little unrealistic.
Right.
Unless you have to. If there's a problem, that's a different story. But it's like I said, it's more about creating that first positive
Right.
experience.
That like relationship with them and going to the dentist, regardless.
And that's another that's another thing too. If you have a really great experience and the child really responded well to the hygienist, tell the front desk that that's who you want to be scheduled with.
Oh, that's a good tip. Yeah.
That there was, and vice versa. If it wasn't so, I mean, you don't want to get them in trouble, but you just might be like, do you have someone that, is more comfortable with children or something like that?
Yeah, for sure. We all know our children. We all have different personalities. We know this, and speak up. Again, it goes back to that, being an advocate for your child and speaking up and, just finding the right person, the right doctor and, the right techniques. So this is awesome.
Sure. I think that's pretty much all I had. Is there anything that you wanted me to talk about, or were there any questions?
I forgot to mention this when we're talking about food, was the one dentist, was talking about, you talked about the starches, you talked about, and I remember going to this one dentist. I had no relationship with them at all. It was like an initial consultation. And, she brought up even granola bars, again, that convenience, but that stuff gets stuck in their teeth and it could just sit there for hours. Goldfish, all of these things that the kids just pop in their mouth, but it's that starch, it's that
breaks down it breaks down to the sugar and then the acid. And
then the other one was like, it's great, go get ice cream, but skip the sprinkles. And I was like, oh, because that'll go in their teeth,
it's sticky.
Yeah, she said anything that'll kind of like slide through, is better. I mean, obviously juice is the big concern. We want to make sure we limit that. But talking about treats, chocolate, the ice cream, and skip the sprinkles. I was like, oh, okay, that makes sense to me.
Right. But if you're packing a lunch to go on a picnic or something, and you want like chocolate's gonna melt, what I mean? So you have to do it in moderation.
Absolutely. Absolutely. I don't say like my kids can't have gummies at all, but we know that if they had fruit snacks at a friend's house or whatever it may be, you definitely need to brush your teeth right now. And
again at night.
So it's just kind of being preventative with it. So this has been great. So if anyone has any questions, I don't see any right now, but if anyone has any questions for Alyssa or myself, go ahead and pop them in the comments and we will definitely be sure to check back on them. And I would love to know, what is your experience with your kids? So what is, when did you take your kids to the dentist the first time? How was the experience you had with your kids? Just share these in the comments here and let us know. And then maybe we could, help, like, oh, this one wasn't so great, but, here's an idea, here's how to make the experience better. So we could definitely do that in the comments. If you guys have anything else that you want to add. Anything else, Alyssa?
Not that I can think of.
You were awesome. Thank you so much. I really appreciate you hopping on. especially last minute, and, giving all of this wonderful information to our viewers. And I'm just so excited to learn more from you.
Oh, thank you.
Thank you so much. All right, everyone. I hope you guys have a fabulous Thursday, and stay tuned tomorrow because I'm going to do an exclusive live with my own kids, and I will be sharing what the dentist was like in their eyes. So how did they navigate the dentist appointment that we did this week, and give you a little sneak peek about, how they felt during their visit. So stay tuned, and we will see you guys tomorrow. But have a wonderful day, everyone. Thank you again, Alyssa. It was such a pleasure.
Thank you.
All right, everyone. Have a good day. I'll talk to you soon. Bye.